Hey everybody, welcome back to Mike and the Doc. I'm Mike,
I'm the doc.
and Doc, it's good to see you.
Good to see you, Mike. It's
Welcome.
been forever.
Yes, it has. It's been a couple of weeks now.
Too long.
Yes, but good to be back on the show. And me, I've just been working and with the family. We just had we had Easter, so
Happy Easter.
happy Easter, happy Easter to everybody out there, and did a big egg hunt in my backyard.
I love that. I love that.
Watch my daughter run all over the place. And
We do this thing where the night before, my wife and I set it up. And it's basically, we used to do this thing where we would buy like the plastic things, and then we would fill them. But that took too much time because obviously there's too many eggs.
Right.
So now we buy it with the egg and the chocolate or the Skittles like what you're saying.
Oh.
And then what we do is we hide them all over, just like our living room and our kitchen. And the kids still love it. They still love coming down the stairs. We always do this thing where it's funny because we're videoing this, right? What we do every year is with my wife's phone, she films. And then I have like this little JBL speaker, those portable speakers?
Yes.
And I play some song whatever song's relevant to us at the time.
Nice.
I play that while they're coming down the stairs and
Oh.
she films. So it's a lot of fun. It's a lot of fun.
That was that was kind of what lit my heart up.
Yeah.
Was watching my daughter come down, and I had gotten two. She requested a bunny and an egg balloon.
Okay.
So I went in the morning actually.
Yeah.
And got the two balloons. So I felt good about myself because my wife does a lot of everything else.
Oh man.
So I was the balloon man, and just to see her face, and I mean, you've had it many more years than me, but I'm just like, and my daughter's 3,
Yeah.
so she's just becoming a human, right?
Mm-hmm.
Just getting all those feelings, and so
She turned 3 when?
January, yep, January.
So 3 years old, that's the age that they all start remembering from.
Oh,
And if you ever wanted to, now your wife is from the Philippines, yeah?
that's correct.
Does she speak to her in Tagalog?
The whole family speaks to her in Tagalog.
Oh, okay,
as well
cool.
as
She can speak it? Your daughter?
no, I haven't heard her.
If that's a thing for you, or maybe that's a thing for your, like I'll tell you personally, like, my wife is from the States, so, and I can speak probably like 4 or 5 languages, but the age that you can teach it to a child such that they don't develop an accent. When I speak Bengali is what my parents speak at home. I was taught from a very young age. In fact, it was my first language, right? But when I speak it now, I have like an American accent. But if you're taught the language before the age of 3 or around 3, then you won't develop. If you use it regularly, which I did not, then you won't have an accent in either. So you won't have an English accent when you're speaking Tagalog, and you won't have a Tagalog accent, obviously, when you're speaking English. She won't have that because she was born here and all. But 3 is when they develop memories, and 3 is also like a language where you don't develop an accent in either.
Wow.
Does that make sense? So like if
Yes,
I
it
go to
does.
Germany and my youngest child is 7. If he goes to Germany and he learns a language, there's a pretty good chance that when he speaks German, he'll have an English accent. But if he went when he was 3, 4, 5, then when he speaks German, he won't have an accent. People won't even be able to tell that he's from America. Does that make sense?
He would have the German accent.
He would have the German accent when speaking German, and he have an American accent. So he wouldn't have an accent at all in either dialect.
Interesting.
Yeah, it's fun. Fun fact. 3 is like a real integral memories she'll remember from 3.
She's big on. She's got a little telephone and she's got her iPad, and I can just see her. The creativity and the learning is just happening.
That's cool.
So you were telling us now you're bulking up.
Yeah.
You did an amazing weight loss. I applaud you for the boundaries.
Oh,
'cause
thank you. Thank you.
It's not easy to say no.
I think that it's interesting you say that because I'd love to say to you that I have like this great willpower and everything. I think for me, and this is a tough one because like my wife, for example, she can say, listen, I'm not going to eat, I won't, I'm not going to I'm not going to just cut out carbs. I'm just going to cut out carbs that don't have a lot of fiber. She can do that. Me, it's more like, I kind of like I'm in for a dime, I'm in for a dollar, and that's really dangerous, right?
Sure.
So what has worked for me is like, for example, this morning I had coffee. Actually, this is my coffee right here. And I don't know if anybody's interested, but like I'll brew, I have like 4 shots.
You love coffee.
Yeah.
Right?
4 shots of espresso.
Okay.
And then there's this protein drink called, oh man, I think it's called Core Protein. It has 42 grams in it. So I use half of that, and that's basically the cream.
Oh.
So, and I'm, I'm lactose intolerant and all this stuff. So I can only, that I can use. So I used half a bottle of that, 24 grams, and 3 shots of espresso.
Very good.
Yeah.
I've been drinking those Core Power.
Core Power. That's right.
They're all over my house.
Yeah.
That's what I've been trying to reach for instead of the sweets.
Well, I'll tell you what. So I do that, and that's all I've had today. And I did like a strength routine. And then in my other thing here, I got a little bit of turmeric, which is like, it's interesting because my parents will use a lot of turmeric in their cooking, but there's no real great way to like know how much you're getting, right? So there's this thing at Costco. I have 2 things. I take CoQ10. And it's in like a liquid form. It's like pineapple flavored. Tastes awesome. And then this one is this has turmeric in it, which is like an anti-inflammatory. They use it a lot in like Indian food. And then I also put some creatine in here. So
right.
I'm using creatine like for the first time in my life. It's about 5 grams a day. And I'm using that. They say to use it post workout. I'm using it probably every day. And I'm trying to do more strength. I really got to work on my strength. I'm using this machine called Tonal. And so on Tonal anyway, it's with cables. Mine only goes up to 200 pounds. There's a newer one that goes up to 250. So you will reach like a plateau. Like for example, doing like legs, 200 pounds is not going to be enough for you or I. But there's one that goes up to 250. But everything else is like, I don't think I could do 200 pounds on the bench more than like 10 times.
Wow.
So that's why I think but the main thing is that it gives you some feedback as to how you're doing. This one thing I'm doing, it's called drop sets. And it basically, measures you once so that you're doing the exercise right with a low weight. Then it measures you a second time. Okay, it says to give your effort, right? And then on the third time, that's your quote unquote drop set. So you're supposed to do that to failure, right? And so what it'll do, it's actually really cool because the thing that I always worry about is injury, right? Because once you get injured, you're screwed for like 2, 3, 4 weeks, right? So on this, what it does is when you're doing the exercise, it actually, if your velocity, so whatever, let's just say you're curling, right? If you're curling and the weight's too much or you're on your 3rd set, so you're kind of done, what it'll do is if it sees that your velocity is slowing down, it'll lower the weight.
Oh.
Yeah, or you can just turn off the machine yourself. But it's called a drops. Yeah, it's great because I can watch it. I can like if I and the other good thing is that you don't know if you just go to the gym. Like I used to make notes on my phone, but if you just go to the gym and you don't know how much weight you usually do, then you might not be making any gains. And my thing is I know it's not going to keep going up forever and ever, but I want, like when I first got back from the cruise, I did really well. I think that was just because I rested a lot. Right. But then my second one after the cruise I was weaker. And then today was pretty good. So we'll see. But yeah, I'm trying to do more strength because you need both for longevity.
And that's great. You think you could bench 210 times?
Yeah, but just with the bar.
Okay.
Yeah, with the bar.
Okay, very good. Yeah. I'm excited to see the I wasn't aware that you were headed, kind of the muscular route.
Yeah, we'll see. I mean, they'll see on the camera.
Right. I love it. You're always working on health and.
Yeah, it's pretty terrible right now. My strength is terrible right now.
And I'm in there. I've told you I'm in with a trainer 3 days a week.
Yeah.
And honestly, lifting weights is not fun for me, and I always want to try to have fun with it, which means lifting light. But they're always trying to push.
Does
me
your
for more.
trainer ever say to you, because there's a dopamine hit, right? So does your trainer ever say to you, "Hey, Mike, you were leg pressing 200 pounds last week, and this week you're 250"? Does he or she ever say that to you?
I'm always lifting more. I've been gaining strength.
Good.
From the beginning.
That's the idea.
Right.
So,
but I always want look. I always I want the muscle and the mirror. You always want a little bit of six pack. So the strength thing to me, I'm always like, oh, that's cool. I don't.
I actually my kids now. I don't know if we alluded to in the last video or not, but I do have a six pack now.
Yes, we did.
And my kids are so tired of me talking about it.
Wow.
But I did we talk about my DEXA?
You were looking into getting that.
So I got a DEXA.
Very nice.
Interesting. I got a DEXA. I have like 1.06 pounds of visceral fat.
Okay.
So that's not good. I want to be under a pound.
That's belly fat?
That's like fat that you're accumulating in your liver. And basically it's a really bad prognosticator for heart disease, metabolic disease. So even though I have a six pack, right, even though it looks good, I'd rather not have the six pack and just have less than a pound of visceral fat.
Okay.
You see what I'm saying? So if you do a DEXA, for example, and your visceral fat is less than a pound, then you're good. That means your diet's good. That means everything you're doing is good. The six pack is just as a result of this period in history where we're at, where thin look is ascribed to looking good, right? Like way back in the day, like if you took a woman that was considered beautiful, they were really curvy, like almost obese by our standards, right?
Interesting.
And that was because back in the day, you're like, oh my God, that's a woman that eats, so she's got money because she's got access to food, and she's got, like, for example, wide hips, so she can support a baby. Now I feel like if they're thin and they have wide hips, that's more of what we look for. Like, I'm just saying, like, if I tried to take out my brain from this and I said, oh, that girl looks good, it's because they're probably thin and they have wide hips, in addition to other stuff, which we don't need to get into. But,
and you think of some of the celebrities out there, and that would align with that.
Yeah, like basically what I'm saying is, if for me right now, I'm not going to do any magazines or do any acting. My thing is I just want to live forever for my kids, right?
Right.
Not forever, but live a longer time for my kids. And so for me to have a six pack versus having less visceral fat is key.
Gotcha.
Yep.
That's the true health. That's actually healthy.
That's what you want. And then the other thing on this DEXA scan, interestingly, is they do what's called a DEXA scan, like when you talk about it in medicine, is to look for osteoporosis, right? Mm-hmm. And so when they did a whole body bone scan, I have no osteoporosis, obviously, right?
Very good.
But when they just isolated to my left hip, and they did left hip because I'm probably right-footed, or you know what I'm saying? Like if I'm gonna go catch a ball, right? If I catch a ball, somebody catches a ball, and I got to move my foot out, I'm probably gonna use my right foot. And then when I write with my right hand. If I throw a ball, it's with my right hand. So they want to use your non-dominant side. So they did. My left hip, actually, the bone density is to be desired, right? So I'm not osteopenic, I'm not osteoporosis, but it's not great. I have to reverse it. And the way to reverse that is by weight training.
Weight training.
Yeah.
I know it's huge for as you get people
older.
age.
Yeah, man.
Because I've had some friends that are big time marathon runners.
Yeah.
But they never lifted weights. They just want to run.
Yeah, myself included. I just want to run.
Right, you just want to run.
I just want to run, man.
But for later on, I guess the 60s, the 70s, the 80s, you need that bone density.
If I'm just trying to, like, usually when I think of things in nature, right? And I can't figure this one out. Meaning, usually if something's better for you, like sleep, it's because that's the way nature intended, right? Like you think about a caveman and you think, oh, if they get more sleep, they'll have more energy, they'll be on it for their hunts, blah, blah, blah. But weight training, it's like, it definitely increases longevity. I just don't understand how that came about. Why in our genetic makeup why is it good to take a weight and move it? I don't get it. Because did we ever maybe carry a lion or some animal carcass to the cave? I don't know. But right now, I need to work on putting weight onto my bones and my muscles.
And I don't know if you have this maybe, but I've always, if I don't do cardiovascular exercise, I don't feel like I got a workout. Yeah. Like I go in for an hour and lift weights. I don't really, if I do legs, maybe I'm sweating.
Yeah.
But otherwise, I don't really feel like I exercise.
Me too. I think for me, what I'm going to use, because you're right, it gets like, what am I doing here, right?
Right.
I think for me, it's got to be the weight. So at the end, at least with Tonal, at the end, it'll say, oh, in today's workout, you've pushed out 20,000 pounds. Meaning, like if you curl a 10-pound weight and you do it 5 times, the Tonal machine will count that as 50 pounds. Does that make sense?
Yes.
So it's basically after a whole bunch of exercises, they'll say, okay, this workout compared to when you did this workout a week ago, you pushed up an extra 500 pounds or whatever it may be. So that helps me because otherwise there's no dopamine and you need to kind of come back to it, right? Or during a set, if you do either more reps or a higher weight, it'll tell you. It'll say new PR, which is, I guess, personal record, and then it'll give you like some feedback. It'll be like a flashing light or something. And you need that to keep going, right? Otherwise, you're just sitting there moving weight.
Yeah, it sounds like it's its own trainer. In a way,
kind of
at home without the physical trainer.
They actually have this thing. Geez, this could be a total like advertisement for Tonal. But basically, they have this thing where you can take your phone, good. Right, and like you can hook it up to Tonal, right, and then what you do is you hook up your phone like this, and then it films you, okay, and then what it'll do is it'll tell you. Let's just say you're doing like a deadlift, right? It'll say to you, oh, no, your deadlift is terrible. Like, your form is terrible. Drop the weight, right? That's been my main thing is I don't want to get injured. So now I'm really focused on dropping the weight if I'm not doing the form correctly.
I'm with you. I want to do that form. You just mentioned that, and I was remembering someone in the gym putting their phone like on the weights or something. And I think that's what they were doing.
They were checking their form?
That they were probably using that Tonal. I didn't know what they were doing. I said, why are they pasting the phone by the Smith machine, which is where the bar is in the machine.
Yeah.
Kind of slides. But that must be something new.
Well, even if you just take a phone and you film yourself doing, say, a squat, you'll be able to see, hey, my back's not straight, or I'm leaning too far forward, or I'm not doing it correctly. Because you can't really see it when you're doing it. But yeah, all these really, and again, these are all things I used to avoid. Creatine, I would avoid. Creatine increases your creatinine, right? So if I ever go to the hospital and they check my creatinine, it'll be high because I'm on creatine. It takes about 3 days to clear, I think. So before I get my next lab check, I'll have to stop creatine 3 days prior. So when you go to the hospital and they check your labs, they usually check a complete blood count, which tells you your white blood cells, your red blood cells, and your platelets. I'm really simplifying it. And then when they check your electrolytes, they check your sodium, potassium, chloride, and they check this thing called blood urea nitrogen and creatinine. That's an indicator of your kidney function. So if your creatinine, let's just say normal is 1 for argument's sake, then if my creatinine is 2, then that means that I'm dehydrated or my kidneys are functioning at half their normal. Does that make sense? So if I go to the hospital, if I went to the hospital because I have I have creatine in here, but if I was to check my creatinine, at the hospital and it was 2, the doc who checked it or whatever provider that checked it could say, oh my God, you have kidney disease or you're dehydrated, so you need to do X, Y, and Z. But actually, if I just stop the creatinine, it'll go back to normal.
And we produce creatine, right?
Yeah, so it's just an indicator of your kidney function, how well your kidneys are filtering your blood.
Very good.
Yeah. I use it a lot. We use creatine a lot. When somebody comes in, it can tell us whether they're dehydrated. It can tell us whether their kidneys are, if they're taking a medication that messes with their kidney function. For example, metformin. If you're on metformin, which I take, right, then that can artificially increase your creatinine at the hospital as well. Furthermore, if you take it and you need to get a CAT scan with IV contrast, that's just this contrast is this thing that they use to make the pictures look better when you get a CAT scan. Then if you're on metformin, they actually say you shouldn't have taken metformin 48 hours. Otherwise, if they give the contrast to you and you've taken metformin that day, it can really mess with your kidneys.
Wow.
Yeah.
Now, you talk so scientific on all of this, and you've been a doctor 15 years?
20, going on 20 in 2026.
Something that came to mind. Has anything, do you see new stuff? Is there anything that excites you or something that you haven't seen when you're out there working as a physician?
In what space?
Like, have you been caught off guard, or you don't know what you're seeing, or is everything pretty much auto?
No, it's pretty auto. I think there are certain things out there that are really they're really fun. Plus, at UMC, it's the University Medical Center, so there's a lot of cutting edge stuff there.
Yes.
The one thing I think that's kind of interesting now that I haven't seen before is when somebody would come in before, and let's just say they came in with the sniffles or their oxygen levels are low, we would do this thing where we would check them. The big one now, right, is we check them for COVID, flu, RSV, and influenza, right? So that's what I would always do. So like I work a couple of rural ERs, and if they come in with those kinds of symptoms, I check COVID, flu, RSV, right? COVID, flu, RSV, yeah. And then if they have a sore throat, I'll check for strep. But there's this thing out there now. It's called a biofire. This I haven't seen before. And when I say before, I haven't seen it. Like when I first started there in January, I saw it a lot. But biofire is this thing that checks for like 18, 19 types of like viruses and bacteria. So it's like you don't even need to check them separately anymore. It's really interesting. And it's called a respiratory biofire. It's not something that we should do automatically because it's pretty expensive, but I imagine probably in the next 2 to 3 years, like med students will be looking at like us, like docs, and saying, oh my God, doc, why did you even memorize COVID, flu, RSV? Just check a biofire. The biofire has everything that you need. And it's not like I think now it's $1,000 to $2,000.
Wow.
But I think by then it'll be cheaper, and then you don't have to memorize it, right? Kind of like there was a time, like this is well before me, when you would check a complete blood count and you'd have to memorize what a low blood count was or a high white blood count was. Whereas now you just look at the lab, it has the reference, and it'll flag you if it's high or low. Right? Wow. Yeah, just a lot more automation.
A lot more automation. The artificial intelligence, I'm sure, is, when I began, I think I've been in the industry about 15 years.
Yeah.
But you had that office doctor that would follow his patients at the hospital. That was pretty well known now.
Pretty normal.
Yourself being a hospital doctor, only treating at the hospital, and that internal medicine doctor is no longer running around.
Yeah, it wasn't great for patients. Right. Yeah. So the old paradigm was, you're right, they would have a clinic. If somebody in the clinic got sick or they looked at them like, oh my God, you're having a heart attack, you need to go to the hospital, they would send them to the hospital. They would go to the ER. The ER doc would see them, and then the ER doc would call their regular PCP, primary care provider, and say, hey, I agree. This patient's having a heart attack. We need to admit them and get them a stress test or whatever they're going to do. And then the doc who's in the clinic is in the clinic probably till 5 and wouldn't get there till like 6.
Right.
So it was terrible for the patient. So from that was born hospitalist medicine, where the clinic doctors would now send their patients to the hospital, and there's a designated hospital doctor who takes care of the patient right when they get there. So instead of getting all this testing done later, they get it done quicker, and they're taken care of quicker, which is obviously better for the patient. Also, what was born of that is now I am not great at clinic medicine, right? And like, for example, my brother's a clinic doc. He's much better at clinic medicine than me. But if somebody comes to the hospital, I've just been doing it for so long, I know what to look for, kind of thing. It's just you get good at your little niche.
Little niche.
Yeah.
Yeah. And you, how about because as an internal medicine doctor, you know the whole body, but referring out to the specialties, the cardiology, the pulmonology, I hear there are the internal medicine doctor that still do try to manage a lot of the patient.
Yeah, so it's kind of gone up and down with that.
Okay.
Little things, like more so in the outpatient arena, right? Like, for example, we were just talking about kidney function, right? So I would see these docs in the hospital consult a kidney specialist when their kidney function went from 1 to 2. So it went, but it was obvious that they were dehydrated. So you give them some fluids, their kidney function comes back up, and you just send them on their way. That's kind of how I was trained, right? Like, you don't call the specialist until you absolutely need them, right? However, in the outpatient world, for example, they did a study where if you're a patient and your kidney function is normally high, like say your kidney function, your creatinine is 1.5 to 2 or 2 to 3, just say, and you don't need dialysis. Because if you need dialysis, then you absolutely need to see a kidney specialist. But if your kidney function just runs high, those patients, when followed over time and they're seen by a kidney specialist, they live longer. So I would be like, why are you consulting nephrology on this patient who's obviously dehydrated? And it makes sense to do that when they leave the hospital because they live longer if they see a kidney doctor. But in the hospital, I don't see the benefit unless they need dialysis to call a certain specialist. But I'm pretty old school. Like, when I call the specialist, it's kind of nice because when I call the specialist, they're like, okay, I'm going to take, they always say, okay, Dr. Ali, I'm going to take the consult, but do you mind just telling me about it? Because they already know that I'm not calling them for BS. Like, I know, like, if I'm that internist that calls a kidney doctor every time a patient's dehydrated, then eventually when they get the call, they're going to be like, oh my God, here's Ali again. She can't push some IV fluids on this patient, like they get to know who calls them too much,
I see.
So you got to temper what's best for the patient and it's called utilization. So another thing that Medicaid is going to do is, and again, I don't want to talk too much about the industry in Vegas, right? Meaning the medical industry, but at least in the private world, we consult the specialists a lot. Not so much at the university, but I'll give you an example. There's this one hospital that actually got tagged. I won't say the name, but they would, when COVID came, it was like no one knew what to do. So what people would do is we would consult infectious disease because it was this new infection, okay? But then now, or like maybe after 3 to 6 months, you don't need to consult an infectious disease doctor on every single COVID patient you have.
Right.
That's not a good, the infectious disease doctors loved it, but it's not a good utilization of resources. So this particular hospital was reprimanded because of their overuse of infectious disease, especially on these COVID patients. So they are looking at that. Yeah.
I think a topic that I hear more than ever now is that ADD
Yeah.
ADHD.
Oh man.
And also with children, there's children being diagnosed very early on.
Yeah.
I was wondering what your take on that is.
ADD, ADHD, it's kind of interesting because I'm so old school with that. I think when I was a kid, maybe I would have been diagnosed with it, but I just think kids, like when you, especially now with like the internet, right? And like
Right.
social, I mean, you can have your teacher talk to you about whatever. Let's take a topic. Say like simple algebra, right? You can have like a teacher talk to you, put up like a presentation, take like an hour to do it. Or you can have these guys on video, like on social, that are making like songs and funky songs out of it. Like their attention span, like if we think our attention span was small when we were kids, now it's like, forget about it.
Worse.
Yeah, like I think gone are the days of you sitting in a lecture hall in university.
Oh, man.
Like you can't do that.
I'd be lost, I think, 10 minutes in. I remember a teacher saying, I think it was 10 minutes. After 10 minutes, even the most studious student is not there.
Oh yeah,
mentally.
And it's like there's this outfit out there called I don't know. I think it's called Essentials of Emergency Medicine. Anyways, there's this program, and they teach you ER stuff, right? And I found it, and like these little videos are so much fun because they're really short, and they're a little obnoxious, right? And so you remember. So I remember there was this one, if I'm remembering it correctly, where the topic they're trying to teach you is the bacteria that you get if you're an IV drug user, the bacteria that you should cover for in the blood if you're an IV drug user, right? So, you could talk about these bacteria and say, oh yeah, these bacteria come to mind if you're an IV drug user, right? Or this lecture it was basically a video of like a patient and the doctor, and then the patient just started swearing, like using like really bad swear words at the doctor, saying, wow, like, what do you think you're effing covering me for? You think you're going to effing cover this bacteria? And they just made it obnoxious and kind of fun. Like you watch this and you just started laughing, right? But you never forget it. Another one when I was in school and training was there are the cranial nerves. So like these are the 12 cranial nerves, and it's like memorizing 12 names, right? And then there's this mnemonic that is so rude and so obnoxious that you'll never forget it. And it involves like, literally like sexual organs, but it's so obnoxious that you don't like, I remember it to this day, right? So right. There are these tools. And so anyways, sorry, coming back to your ADD, I think that it's definitely out there. It's going to get worse because of how quickly things are given to us in social media, right? So you want to make the person watch your video, and so you're going to package it. You're going to package it so it's exciting, more exciting, more exciting. It's got to be exciting. It's got to hit you right away, right? So I think that's good for people viewing. But as far as now, when a child has to learn something maybe the regular way, or maybe it's not a topic that you can teach in 2 minutes, right? That's going to be a problem, right? Like those topics are going to be an issue for kids.
I like that. So you're more kind of old school with something that is going to jog your memory, something that you'll remember.
Yeah, like I like teaching things in a fun way. Do you? This one comes to mind. Do you remember Justin Timberlake, the song "Bringing Sexy Back"?
I do.
Okay.
Yeah.
There's
funny.
There's this rhythm called "Winky Back." Okay, and so they made this stupid song about. It was in the style of "Bringing Sexy Back," but it was called "I'm Bringing Winky Back." Okay. And so, like, I remember that to this day. So I think they're fun and they have their use, but not everything can be taught to you in like 2 minutes. And honestly, like to live life where if I'm trying to teach my kids something, right? Like say about the market or about gratitude, it might not take 2 minutes. And I won't have all these visual aids. Like I won't have a celebrity pushing my thoughts on being grateful, like they need to be prepared to learn it at a somewhat of a different pace than what is fed to them on social.
Very interesting. And I know you've trained obviously your children.
I'm trying.
You're trying, and I know you've trained hundreds of physicians.
Yeah. The residents
as
they're
well.
fun. They're fun.
Right.
Yeah. I do. It's funny. The old school, right? I kind of am like I've been very blessed. My job now involves me. I can be a good cop, right? But like I'll give you an example. The last time I was on shift, there was this patient who was obviously septic. So septic is when you have a really bad infection, and septic shock is when you drop your blood pressure. But sepsis by itself is just a bad infection. So this ER, I don't know if it was an intern or what have you, they called me and they had this patient. I said, they basically asked me if they can come inpatient or OBS. And so I say, oh, well, this patient has sepsis, so that patient will be inpatient. And so that's kind of where I stop, right? And I've asked the residents, I've asked the attendings, say, hey, listen, do you want me to try and prepare the resident because they're going to call one of my colleagues to actually admit the patient, right? Because that used to be my old job. And the attendings don't need me to coach them because they've been presenting to other attendings forever. Some of the residents want it, but some of the residents don't. The overall consensus that I've gotten is that they don't want me to coach them. So I did it this time. And so this resident called the hospitalist who was admitting, and the hospitalist was like, oh my God. So the response was, do you think this patient's septic? And the resident was like, yeah. And then the hospitalist who was called was like, well, what antibiotics are you covering with? And he's like, oh, I gave this and this antibiotic. And then the hospitalist was like, well, they were just at a nursing home. They were just at the hospital. Aren't you worried about this particular bacteria? And so then the intern starts kind of cowering back, and they're like, oh, I don't know. I didn't know to cover for that. And the thing is back when I was a resident, that was called pimping, and they did it a lot. I think it was excessive, but I tell you what, every time I got pimped, I remembered. Like I remembered even still to this day. So they use now a little bit of like fear, right?
Right.
They don't do it even 1/100th of as much as what they did, like say 20 years ago. But if you can kind of put them into a nervous spot, then that intern will never forget how to treat sepsis
Right.
after the way my colleague kind of talked to them. So it's good. It's because now every patient after that, they'll know how to treat sepsis, right? Whereas this one, they were kind of like half-assing it.
I see.
Yeah.
Yeah, things, you always go back, and it seems to be everything is tougher. In the prior 5, 10, 15 years, things have, I was even talking to somebody like coaching nowadays, right? Even this was college basketball, and they talk about the Bobby Knight days where you throw the chair across the court and scream at the kid. You just can't do that.
No, it's there's so much about training that is really nuanced.
Yes. Yeah, and even myself, leading a company, I've changed a lot. I kind of used that fear early on because I was fearful that I wouldn't have any money left, and we got to get this thing going just to survive.
Agreed.
And now it's much more, I'd say, loving and motivating, trying to teach like you talked about. And it's a very, I had to grow up in order to get there because I didn't even know that existed really. You see the way coaches do things, the Bobby Knights, the Coach K's, and it's all aggressive.
Yeah.
It's, make it happen or don't be on the team. And so I see the world changing. I see that. I see that happening.
Yeah, they talk about this thing with residents anyway. They call it like a sandwich. Like you give them a compliment.
Right.
You give them what they need to improve. You end it with a compliment.
Right.
Okay.
I've heard that one.
You heard that one? The compliment
sandwich.
sandwich. And so I think now as leaders, right? Now as a leader or a teacher, you have to, because there is a point, right? Like you can coddle a resident or an intern, and then there's a point where it's like I think before we used to approach it too quickly, but now if you're like, say, in your last year of training and you don't know how to treat a septic patient, we have some problems, right? Like
Right.
sometimes you just need to give tough love. I'm so blessed in my job now. I'm always good cop, right? I used to be bad cop. Now I can be good cop. Sometimes after they get torn a new one by my colleague, they'll then come back and say, "Hey, listen, are you okay with these antibiotics?" And sometimes what I'll say is, what I'll say now is, "Hey, listen, as far as I'm concerned, my job is to tell you whether they're inpatient obs or they can go home. So we've already made that determination. But if I was the accepting hospitalist, I would want you to get X, Y, and Z labs and X, Y, and Z imaging." And so they appreciate that. And I think they're starting to take that more into consideration. And the other thing that's so good, such a blessing, is let's just say we're talking about electrolytes like sodium, potassium, right? Let's just say somebody comes to the hospital and they have a really low sodium, right? My job is their sodium's low and they have symptoms and they have other criteria that makes them inpatient. That's my job. My job is done, right?
Right.
So they meet inpatient criteria. And so I'll tell the person calling me that, and then they'll call the hospitalist. And of course, when they call the next doc, the next doc is going to be like, why? Why is their sodium so low, right? And so now what I can do is I kind of tell them that the patient meets criteria or not. And then what I have now is I have this luxury of brushing up on the causes of low sodium or whatever, the causes of whatever lab abnormality or whatever, I'm short of breath, but all my scans are negative. Something that's kind of like, you have to look up, you have to like research a little. So I'm really blessed. I get to look these things. It's actually it's such a great time right now to be like, because you know what you know, and then you know what you don't know, right? And I'm able to actually look up stuff that I don't know. If it happens, it probably happens like maybe once every like 30, 40 days that there's this case. I'm like, oh, that's a really weird case. I'm going to look it up. And you learn something because you remember, it's a really great time.
Yeah. For you to have to look it up, that's kind of abnormal.
Yeah. It's going to be like maybe one in, I don't know, maybe 30 a day, 30 times 7, 210, 410. So about one in every 400 cases I'm looking up.
Wow.
Yeah.
And with all this resident talk, I just wanted to say over at Connolly Care Home Health and Hospice, where we work together, we're beginning to engage with the nursing program at UNLV.
Oh, fantastic.
And the medical school program. I was at the match day.
Oh, cool.
So we're going to be kind of getting more involved with them, and
I love that.
Exciting times.
Yeah. There's the residents. I feel like they're 90% of the residents really want to learn, and it's good. It's good. And the thing is early on in your career, you're like early on, and this is like a total like insecurity of my personal insecurity. Early on in your career, you're like, oh my God, they didn't teach you that. But now it's not insecurity for me anymore. It's like, hey, here's this young, like coming back to the sepsis example, here's this young fledgling doc, right?
Right.
Maybe they don't like, not me, because I can be good cop, but let's just say I was the bad cop. Maybe they don't like me because of the way I made them feel about this particular patient. But I'll tell you what, in my brain, that intern is going to grow up to be an attending that knows how to treat sepsis really well. And that's just good for patients and society in general, right? Like for me now, it's just how do I move the needle so that more people are taken care of? People talk about being a regular person or being an academic, right? If you're an academic and you teach lots of people, then you're moving the needle with hundreds, perhaps thousands of doctors, which means that you're helping, hundreds of thousands versus multiple hundreds of thousands of patients. So there is a role to academia, but I've been in the private world longer than I've been at the university. I have another question for you, Mike. I just showed you and you, Trevor, a couple of pictures, right? And we could be like, hey, Trevor, could you throw up this terrible picture of me with a white shirt? And I could totally send it to you. But you could see, like, it was terrible, like dead man walking. And it's really interesting because I was in it and I knew, right? Like, when you're in medical, you obviously study about lipids and cholesterol and heart attack risk and smoking, and you are in it, and so But then I look at that picture and I'm like, I knew, and I was still I don't want to say victim because I don't love that word, but I was still subject to all those bad things that were going on with my health. So I'm really curious, like, you're obviously in healthcare, but you're kind of on the business side, Mike. So how did you balance it or did you have that realization, or did that ever happen to you where you're like, oh my God, work is good, body's not. This requires time for me. My body requires work. I should treat my body like a temple or like a job and not just treat my job like a job. Because, obviously job pays the bills, right? So how do you balance that?
It's a really good question. And I think I was faced with that. Obviously, when you're starting a business, and I think a lot of people want to start businesses, you really have to go all in on the business. That has to be your life. So I remember when I was starting that you'd work 16 hours a day. You'd work 12 hours a day. And we're in medical, so it's all rapid response, responding to the referral sources, the doctors. So you have to answer when they call. Otherwise, they go on to the next company. Until you build yourself up enough where you could get the little guy in there and get yourself. I think that's what I work on now, is really having a layer in between me and everybody. Not because it's more to free me up so I could do more. So I could be here with Dr. Ali doing the show, looking at growing other service lines. But as I remember, and again, it was my mom and I were the first two at the company. And she doesn't really think exercise. It's not, she works very hard, which I think is her exercise. And so I'd say, I need to go take a swim, or I need to go to the gym. And I would feel bad. Because somebody's got to do the work. So I think that's a huge thing. Boundaries in business is, and when you're starting, you're always in service. Right? We're all service people. We're serving the clients, the patients. So at some point in your business journey, you have to get away from that service in order to free yourself up so you could focus on other things, right? Like I became a family man. I became a father. That's really where where I put a little bit of weight, or I felt more unhealthy, is just I was caring for my daughter, working with my wife to co-parent. So getting out to the gym and remembering to eat healthy, it wasn't always top priority. And 3 years into being a dad, or maybe even 2.5 years, I was able to once again get back to the gym and focus on health and well-being, I'm very much into meditation. So I think as I've had more responsibility, or we want to do more as an organization, I have to free my mind up, and meditation has been big with that. Or those layers, though, the layers of command is really kind of what helps you expand. And we were joking before about Jeff Bezos, the picture where he's at the desk. I think it's Amazon 1999, and his hair's all over the place, and he's definitely not wearing a fitted shirt, right? He's got the shirt we buy at J.C. Penney, and flash forward to now, I mean, the guy's like Terminator, and I think that comes with money too, right? You start to make good money, you look and feel better, or you should, right? If you're focusing it. I mean, these guys probably have trainers that are with them round the clock. The chef too, which I don't have. If somebody was cooking and feeding me around the clock, I think you could trim down.
Yeah, I like the resources, and getting back to your daughter's 3, right? So
Yes.
those fat pictures, or maybe that's not. Maybe I should call them my big pictures. Those were all when my oldest, who's 13 now, was 3, and my middle daughter was 2, and those are when I was my biggest. And you're right. You make a decision. Some way, I don't know, either you make it consciously, subconsciously, but you make a decision that my family takes precedence. How do I serve my family, right? Because our wives kind of handle everything at home, right?
Right.
So they're the CEOs at home. So they handle everything, and I'm very grateful for that. It's not for everyone, but it works for me, and it sounds like it works for you too. So they're the CEO at home, and then my job is to make money so that my children have a future. And so what happens is I must have gone into that subconsciously, because when it comes time to, hey, I can pick up another shift and make more money for the family so the family can benefit, then you're like, you're not doing any self-care, right? You're not working out, you're not eating right, because at the end of a shift, if you are like so dog tired at the end of a shift and there's some Cheetos right there, I mean, those Cheetos call you.
Oh yeah.
They say, hey,
Yeah, they do.
This would be just great. You got to make a decision. And then you were saying about just exercise, like my family, right? My family is extremely pro school. Like God forbid we ever go to some destination that wasn't about school. So we would take vacations away. I was born in Toronto, right? So we would take vacations away from Toronto, but they would be to like where like my brother could potentially go to university. How about just going to Florida or going to Disney? It's like, why would we go to Disney? Why would we go to Florida? We're not going to school there. We don't have any relatives there. It's like, yeah, but how about just going for the sake of vacation, right? Or this is one that was really interesting. Is like, we were talking about this a little bit before. Like, how you get to a certain point where you've worked out and you look good in clothes, right? Well, that's kind of superficial, right? So in my life, it's always been, certainly with my parents, they've always been like, oh, you're working out to get thin so you can look good in clothes? That's superficial. That's like so anti-religion, whatever religion you're a part of. But it's like, so it would get to a point where I'd say, hey, I'm going to go work out. And they'd be like, what, you're going to work out your chest so you have a big chest so you can wear these muscle shirts? That's superficial. And so what happens is there's this correlation with being healthy as being superficial. And that was a really huge mistake that we had, at least when I was a kid growing up, in our culture, is being healthy, looking good was superficial, and therefore we should avoid it because being superficial is bad. And I don't know if other people, I don't know if Trevor, if you've had that, but like I have seen that a lot in East Indian culture. So you'll have somebody who's like totally overweight, totally lost everything, right? Like they've lost their control. And then people look at them and like, oh yeah, but he's really busy and his kids are doing well. It's like, yeah, but if you look like that now, like those pictures I showed you, those are from like 10 years ago. I mean, I was like a dead man walking, right?
So you don't feel like you're serving at the highest level when you're there, although it's looked at, he's sacrificing everything. And I'm with you on that I think if you're taking care of your health, then you could serve at a higher level.
I like that. That's actually a really good one.
Maybe.
I am going to the gym today so that I can serve my family at a higher level. I'm not saying that I think that what you said is perfect. I'm saying that out loud so my brain can digest it for the next time that I don't want to work out, right? And anybody else who's listening who maybe suffers from this problem should take that and drill it into their subconscious. Like, no, you exercising is not a bad thing. You're actually doing it for your kids.
I like that because I think people sometimes feel bad taking the time away from their family. But if you put it like that, now it's a positive.
And there are times when you try, like I'll sometimes try and run. Like when I run, it's about an hour, hour 10, hour 15. Then you add the shower, it's probably 2 hours all in, right? And if I'm doing that on a day that the kids have off, I still at times feel guilty, right?
Yes.
But I have to tell myself and tell my subconscious. I'm tapping on my brain. I don't know if that does anything to my subconscious.
Yeah,
but
I think so.
I'm tapping on my brain saying, you doing self-care and self-love, I guess, is so that you can serve your family at a higher level. Yeah. Because I still suffer from it.
And I read, I think I read somewhere LeBron James, he spends $1 million a year on self-care, things to, make sure that he gets to the next level with all the responsibility. So I think as you go on and you age or you have more responsibility, you got to invest more in yourself.
Yeah, I think I've earmarked maybe like $1,000.
Right.
for myself.
We're on the low. We're on the lower.
1,000 times less.
Lower level. Right.
So, Mike, I think what we're talking about here is we're talking about balance, right? So because this I think is where I think the audience, myself included, would really benefit. Is if you could go back in time, because you got to be if you want to be successful, you got to go all in. But there's your business, and then there's your body, or just say your business and your life, right? What would you do differently going back, knowing the balance that you have right now? What advice would you give to somebody who's going to start a business now so that they can A, be successful in their business, and B, and not in this particular order, and then B, make sure that they maintain balance for self-care?
Great question. I think going back, I wouldn't do anything differently. I like what you said. You have to go all in. It has to be top of mind. I didn't have a family. I wasn't married when I first started the company. I did have my wife. She was my girlfriend at the time. So you definitely, if you're starting a business and you are married and you have a family, I think you need to prioritize those things with the business. So I wouldn't sacrifice those. I would want to balance them, in that kind of triangle. But it's very hard because this is all or nothing, right? We're either going to win or we're going to lose. Maybe you could fall in the middle, but I think most business creators, that there is no middle. It's either all in or not in. So I would try to prioritize everything with making a little bit of time for the exercise, a little bit of time for the self-care. But I know what they go through in the beginning. It's not easy. So, doctor, based on the question you asked me with what does it take to create the business, now going all in and pretty much sacrificing your body and your psyche, what type of toll, or what is your opinion on that from the medical perspective?
Well, I think maintenance is always better. And I'm somebody who likes to just kind of tell it like it is, right? Because I don't like to candy coat things, especially with it's interesting when I tell family members, okay, when they say they come in with a really bad, they just unfortunately on whatever day they come to the hospital, they get a bunch of scans, they get a really terrible looking scan that looks like cancer everywhere, right?
Wow.
I always come clean, right? So I used to candy coat maybe, I don't know, 14, 15 years ago, I would candy coat the story because there is some hope, right? But now I just come clean with it. So I'm that's the kind of person I am, is I always like to come clean. I don't like to candy coat anything. There's no rainbows and unicorns, right? But with this, I think I can be a little bit more hopeful. So maintenance is always better, right? To maintain your health when you're in the startup period of a business is always better. For me to have been at this weight when I had my kids at 3 and 2 would have been much better. But the good news is that you can sometimes reverse things, right? So I never checked my blood sugar at that time. With me in that white shirt, I can't imagine it wasn't bad. I can't imagine I wasn't pre-diabetic. I can't imagine that my LDL wasn't way above 200. I can't imagine that I had some degree of atherosclerosis. That's where you have plaque buildup in your arteries, the big one being in your heart arteries, your coronary arteries. But if you can change, I think you can reverse it. And that's why, like, certain things you can't reverse, for example. And even this area, like when I was in training, the thing that they always taught us was brain damage you can't reverse, right? Even now, though, like very recently, and this is a huge topic that I'm not really good at, but I know there's this thing out there called neuroplasticity, okay? That's where the brain, which historically you never get back your brain. Let's just say you have a really large stroke, right? You don't go from having a really large stroke and not being able to move your right side most of the time, 90% of the time, you're not going to go from not moving your right hand to moving it one day. That's just the way the brain is, right? Now, most other things in the body do adapt and do learn. So as far as your health is concerned, you can bounce back, right? Like, I mean, and you use certain markers, right? Like if I looked at when I was, say, 20, right? How much could I run, right? I'm sure I can run more now. Or if I looked at how much I could bench, I'm sure I could bench way more when I was 20, right? But I could work up to benching more, I think. If I take creatine, if I make sure that I do it right, I make sure that I'm getting enough sleep, I make sure that I'm taking the right things, external molecules. So I think there is a lot of hope in that area. I think that you can reverse it. You can't reverse aging, or I'm going to try, but you can't reverse the number of times you go around the sun, but you can reverse what your body looks like. If you have all the, like this guy Bryan Johnson, right? He always talks about that he's better than, not better, but his labs and his muscle fibers and all these different tests that he does, they all surpass 1% of 18-year-olds, right? He's not wrong. He's not wrong. So if you look at those parameters, he is much healthier than he was when he was 18, right? So there's a lot of things that you can do. And it's actually very hopeful is what I'm saying. So if you're out there and, you're like super obese and your business is finally taking off, right? So I guess my advice to the guys out there would be, if you're out there and your health is not where it needs to be, because it needs to be there. Because if you're not there, then if you die, your business dies. Or if you die, your children don't benefit. So you must make your body and your health priority number one. So make your body and your health priority number one. That's the first thing I would say to somebody who's obese who has to say a successful business, or somebody who's obese and they're at the end of their residency training. And the other thing is that if you're even luckier and you're about to start your business, or you're healthy and you're about to start residency, just maintenance is key. So maintain it. That's the best, no matter how you look at it. And then if you're there and you've already kind of gone down the road of kind of quote unquote failing for your body and your health, then there are things that you can do right now, and they do have long-term effects. So good news overall.
I like that. Thank you, doctor.
Oh, sure, man.
What are the first steps somebody could do to start reversing those negative effects?
Good question. And this is actually super easy and super, it seems like it's like duh, right? But it's duh when you think about it, but it's not duh when you think about how many people actually do it. Okay. So if you're a young person who's starting a business, or I'm just using our particular examples, but you could use it for any occupation. If you're at the beginning of your career and you are, I have an interesting story about this actually. If you're smoking or you're drinking, those are two things that you can just cut out. Now, smoking is easier now, but when I was a kid, to say to somebody you'll never smoke again that was like, well, whatever. Now, with drinking, there are still some facets of society. I know you don't drink, right, Mike?
I don't drink.
Yeah, and that's uncommon. So you know, it's very uncommon.
I used to drink. I quit.
Oh, you quit? Okay.
Yes.
But if you tell somebody, hey, you got to go from whatever you're doing now. Let's just say you have a drink every day on the weekend and maybe twice during the week. If you say to them you should never have a drink again, that still is the best thing for their health. And there is no benefit to drinking. You know how we used to say drinking red wine could help you with that? It's not good. The amount that you would have to have for it to clear out your coronary arteries is too much. So drinking by any estimate is not good for you, and you should cut it out. But you can't really say that now because there's a lot of people in society that would be like, oh, there's no way that I'm going to be able to do that. So I would say at least cut it down to a good portion, right? Because remember, back in the day, you could tell somebody you could never smoke and be like, whatever, I'm going to smoke. And now I feel like you can tell somebody you could never drink and they're going to say, no, I can't do that. I need to drink socially. But that would be the one, is cutting out drinking and smoking. And once you do that, especially as a young person, I think you're good. And then the other thing would be weight. So get your weight down. Like myself included, it's so funny when you're at the hospital, right? During COVID, let me give you an example. During COVID, you'd have a young person come in. It's unfortunate. They'd be young, and typically these patients, this is just what I've seen. I'm not saying that there's a reason, but typically young Black patients would come in and they would have COVID and they were kind of obese, and a lot of them would die. Wow. No medical problems. So young, obese, Black, right? And they would come in and they would die.
And what is young? What age?
Sub 30.
Sub 30.
Yeah.
Okay.
So like 20 to 30. Like these are like,
wow.
Yeah, these are awesome years, right?
Awesome.
And what's crazy is we would look at them afterwards and we would say, yeah, but you know, they had a BMI of like 50. So it's not written in any book, but somewhere because we've just seen it so much, being obese is just not good for you for almost every aspect of healthcare, right? So that was the first example. Then there's another example. I have a neighbor who's in business, right? And it's so funny because he was telling me he's super successful, right? But he was telling me that drinking is just part of the culture, right? So you're at work, you close a deal, you go out and you drink, right? You're at work, you don't close a deal, or something really terrible happens and screws up your business, you have a drink.
Right.
That's during the work week, And then there's the weekend, right? So what happens is, and it happened, I think, with my neighbor, is just going out to drink it's just a given. And it's terrible for you at all, but terrible for you at that frequency.
Right.
So smoking, drinking, weight loss, and then I think another one that is a silent killer. That was a problem for me before, was blood pressure. Okay, so you don't know what your blood pressure is running, and it's true. If let's just say the normal number for a person is 120/80, right? So a systolic of 120 millimeters of mercury over 80 millimeters of mercury. That's normal blood pressure. If you have a blood pressure of, say, 140/80, that will do nothing to you for a month, 3 months, 6 months. But over many years, I'm talking about like 3 years, 5 years, that's what causes all the badness. And you don't feel it. Like uncontrolled blood pressure for 3, 6, 9 years will cause you to stroke, will cause you to have a heart attack, cause you to go into renal failure. And those are those are the ones that kill a lot of Americans. Mm-hmm. So if I had to summarize it, I would say no smoking, or at least curtail it a little bit, no drinking, or at least cut it down a little bit, and then weight loss and blood pressure control.
So how do you maintain a proper blood pressure?
Good question. You actually do it. Are you on any blood pressure meds?
I'm not.
Awesome. It's really interesting. I don't know. I don't want to obligate you to this, but I wonder if you would need blood pressure medications if you didn't do meditation. So meditation is so awesome. Breathing costs nothing. Right. Meditation costs nothing. And you'll be surprised. We don't do it here in the West, but they do it a lot in the East. You'll be surprised what you can do to your blood pressure just by taking a minute or a couple of minutes and just recentering. It's so important. They do it so well in the East. I wish we adopted it more here. But if you can't use regular things like meditation, then you can use medication. All the medications have side effects, okay? So what you need to do is probably speak to your healthcare provider. And that being said, another thing I want to make clear is that people talk about medications like, no, I don't want to take any meds. They have side effects. Yeah, fine. You don't want to take medications that have side effects, but you don't want to have a stroke or a heart attack either. If 10 years from now, take a sip of my coffee to raise my blood pressure.
Sure.
So if 10 years from now you have a stroke or a heart attack, that is the worst. That's worse than any side effect, right? So if you take a really small dose of amlodipine, like a blood pressure medication, and it can cause constipation or it can cause, nausea, right? First of all, those side effects are rare. And second of all, you need to at least try and do that if the regular measures are not working. Because people talk to me all the time, like, I'm not going to take a medication. Okay, but you're going to have a stroke or a heart attack.
Right.
And is that worse than having a little bit of constipation? You know what I'm saying? So people really need to, there's a lot of people that are anti-med.
Yes.
And I used to be one of those guys. I used to be very pro like natural stuff, and I still like some natural things. But, cocaine's natural, and there are many things that are natural that are not good for your health. And there are many things that are made in a lab that are good for you. Like, for example, aspirin. If you don't have a bleed in your stomach or your brain and you're under 70, I love it. I take it. So, those are the things I would do and obviously weight loss, exercise, those things will help with your blood pressure as well. Sorry, I didn't mean to cut you off. It all goes hand in hand. Like when you start moving on one thing, it will snowball, but in the right direction. But if you start losing in one thing, like let's go back to the business and obesity, right? If you are obese and you're getting more obese and your business is successful, I can guarantee you there's going to be a point where you can't, getting back to your original point, where you're not going to be able to serve at a higher level. And then you're just going to serve less to your business. And then your business is going to not fail, but it wouldn't be as good as if you were in top physical shape.
Right. Great advice.
Sorry, I cut you off. What were you going to say?
I think I was
have
just
a tendency to do that. I'm sorry, guys.
I think I was just going to say that me, in general, myself, I like to trust the doctor, which is if they recommend me taking a medication, I'm going to take the medication.
That's really cool. That is very much how it is like in my parents' generation. I don't see that trust anymore, though, in a lot of kids.
I see more of this natural. There's like a natural phenomenon where there's a natural something for every pharmaceutical, and I don't see the natural stuff working anywhere near as well as the lab produced, if you may.
You know what's funny is like I give this as an example. So I don't eat pork, and I've heard it's really good. But anyways, I don't eat pork, but I'll tell you, there's this thing out there where your blood sugar is really, really high. And as much as we don't like to admit it, our pancreas, our insulin is very similar to pig insulin and pancreas. Okay. Maybe I take that back. Not pancreas, but certainly our insulin is very similar molecularly to a pig's insulin. So if I, one day, God forbid, I come into the emergency department and my blood sugar is really, really high, you give that pig insulin to me no matter what my belief system is, because I don't want to die, right? Now, there are some people that, like, for example, and I don't want to get too political with this, but like there are some Jehovah's Witnesses that won't take blood. Sometimes they, just from personal experience, sometimes they change their mind if they know that it might kill them. But agreed. Like if my heart rate, when I come to the ER, if my heart rate is 180 beats per minute, normal being 60 to 100, and I say, hey, why don't you try some meditation? Because, I love meditation.
Right.
But if my heart rate is 180 or 200 in the ER and my blood pressure's in the toilet, do not tell me to do meditation. Give me the medication that will raise my heart rate, raise my blood pressure and lower my heart rate. So I'm with you there. There are some things that are, I think the main thing that I would say is you can take really small, it's easier for me because I can titrate things, but you can take really small doses of things, The things that they manufacture are so potent and they come with a lot of extra stuff, right? So a really stupid example I'll use is smoking, right? If you think about why you smoke, right? You're smoking, like some people smoke, I won't say who, I won't give them away, but there are some people that smoke to help with memory retention for a test, okay? And so that's from the nicotine, right? Now, if you smoke a cigarette, that has nicotine and other crap in it. A lot of the other crap gets you, right? So why not, I'm not saying that you should smoke at all, but why not just take some sort of nicotine delivery rather than taking the cigarette, right? Which has all the extra stuff in it. So if you take a medication that you're using for a specific reason, I would say, I'm not like totally natural, I'm not like totally synthetic. I would say find the one that is kind of pure to form. Like it's just this without any filler, for example.
Doc, I just want to say I had another great episode with you. Always good to reconnect, and looking forward to the next.
Yeah, me too. It's always fun, and we always hit so many things. Yeah.
Especially today, we hit on so many topics, and I learned a lot from you, like I do every time.
Oh, good. I'm glad. I learned a lot too. I'm gonna tap that one into my brain, into my subconscious. Yeah. It's really interesting. I think I don't want to one up you, but I think I gained more from you from this episode than you from me. That one comment about, the one statement that I need to take care of myself to serve my family at a higher level, that I'm going to try and use the next time that I feel guilty for working out and say not spending an hour with my kids. So
Very
thank
good.
you.
No problem. Very much enjoyed.